Main causes of rectal bleeding can be divided into bleeding from anus and bleeding from the rectum and the colon intestine above it. They can further be subdivided into benign causes and malignant or cancerous causes. If we take benign bleeding from the anus first, most commonly bleeding happens from hemorrhoids or piles, which are natural internal vessels, can become distended or engorged and swollen in life and present as bleeding, which is usually painless. Another common condition which can cause bleeding is an anal fissure. This is a tear, a split in the skin of the anus, often associated with significant pain as the stool is passed. Anal fissure or fissuring of the skin can happen from minor tears and simple chafing or splitting of skin with overzealous washing, using too many drying soaps or detergents, or simply dry skin conditions such as eczema. Other less frequent causes of benign bleeding are anal fistula or abscess. These are infections which can cause pain and swelling around the anus, sometimes blood and also pus. Anal bleeding can also come from anal warts. These are viral infections, extremely common, human papillomavirus, and this can present with itchy lumps and bleeding. Unfortunately, anal cancer can present as simple bright red bleeding, and these are often presenting with ulcers or firm nodules, irregular lumps, and they can be quite painful. Typically, anal bleeding is fresh and bright red. Bleeding from the rectum can be darker, or blood can come from inside the rectum and the colon. And here the causes are many. The commonest causes are diverticular disease, which happens middle ages to elderly patients. This is a common wear and tear of the intestine, and it is benign and usually presents with either heavy hemorrhage, which can be quite serious, or minor bleeding, which is of no consequence. Unfortunately, diverticular disease can also present with severe pain and inflammation, and even in severe cases, perforation of the intestine. But bleeding from diverticular disease is extremely common. Other causes of bleeding from the rectum and the colon are inflammatory or infective conditions, such as severe infective diarrhea, dysentery. Also, inflammation of the intestine, such as Crohn's disease or ulcerative colitis, present with mucus, blood mixed in the stool, or dark blood. Unfortunately, we must always mention colon cancer and rectal cancer and polyps. These are malignant or precancerous conditions which present with rectal bleeding and must be, of course, diagnosed and treated. When thinking about color of bleeding and trying to diagnose rectal bleeding, patients may ask many questions. In particular, what's the importance of blood that's dark or blood that's fresh? If you think of bleeding coming from the anus at the very lower end of the intestinal tract, usually blood is fresh, and if the blood is darker or it's altered in any way to change its consistency, it is often considered to be coming from further inside, from the rectum above, or in the intestine itself, the large bowel, otherwise known as the colon. The importance of this is to simply try and determine, as a doctor, where the bleeding might be coming from and to reach a diagnosis. However, we have to be very cautious because many conditions that immediately are outside around the anus, such as hemorrhoids, can also present with blood that's darker, blood that's altered. And also conditions which are thought to be coming from higher up in the rectum, such as a polyp or even a rectal cancer or colon cancer, unfortunately can present with faster bleeding and blood that comes through quite fresh. So we mustn't solely rely on the color of the bleeding when diagnosing the site of the bleeding. But generally speaking, if the blood is fresh and bright red and only noticed when patient wipes after toilet, or notices drops of blood in the toilet pan, or streaks of fresh blood on the stool, we can assume that is coming from the anus, and that examination of the anus and the rectum in many cases may be adequate to diagnose the problem. Whenever there is dark blood, or the blood is mixed with the feces, with the stool, we must look further up inside into the intestine to find the cause of it. But the word of warning here is that we must not simply rely on color of the blood when diagnosing where the bleeding is coming from, because it can be deceptive, and unfortunately many conditions can present with either fresh or dark blood, and this is when a specialist needs to see the patient and diagnose where the problem is coming from. Now, this is a very difficult question to answer. When to see the doctor when you've seen blood in your stool? There are many causes of rectal bleeding, or blood from the anus or the rectum. And a vast majority of these are simple, and they do not require to see the doctor. The important considerations are the amount of bleeding, the color of the bleeding, and the pattern of the bleeding. And I'll take these one at a time. Bright red rectal bleeding intermittently with minimal blood seen on wiping after toilet is often caused by a simple problem such as a cut on the skin, a fissure, or small hemorrhoids, which can be treated with simple measures, either over-the-counter medications or dietary means, and doesn't always need to be referred for a doctor to see. However, if there is any associated other symptoms, such as a change in one's bowel habit, in other words, if going from regular bowel pattern to developing constipation or diarrhea in association with rectal bleeding, even though it might be fresh blood and considered to be from the external aspect, this kind of bleeding must be presented to the doctor. Age matters as far as patients are concerned. Patients who are over the age of 40, unfortunately, any type of bleeding, whether it's fresh, whether it's intermittent, whether it's painful or painless, or should refer themselves to a general practitioner who will then decide if they need to see a specialist. Because unfortunately, with age come other conditions such as rectal polyps, bowel cancers, and other conditions which are important to diagnose and treat. Even benign conditions, which are non-cancerous, need to be seen and treated. The other consideration to have is that the blood that we see, is it mixed in the stool or not? So whenever you see patient sees a blood, any kind of blood, fresh or dark, that's mixed in the stool, it's generally thought to be arising from somewhere inside the rectum or higher up. And those mean that you can have an inflammatory condition such as colitis, or a malignant condition such as a cancer, or other important bowel conditions that need to be seen and diagnosed. Any patient who has had associated symptoms such as weight loss, abdominal pain, again, a change in bowel habit, especially to diarrhea or loose stool, must present to their general practitioner when there is rectal bleeding. So to summarize, bleeding which happens in isolation in a young patient, perhaps below the age of 40, bright red blood seen only on wiping intermittently, and it stops, it can be safe to treat on the assumption these are caused by simple anal conditions. However, if these conditions do not stop by simple treatment, and if there's recurrent fresh rectal bleeding, again, this is something that you must present to the general practitioner or to a specialist to investigate and diagnose, because even simple intermittent fresh bleeding can be indicative of an underlying serious pathology. So rectal bleeding is not to be ignored if it recurs.